fracture. So a femoral neck stress fracture, it's basically a fracture along the neck of the femur, and it's mainly caused from, it's an exercise-induced injury. It's found in a lot of endurance athletes and military recruits as well, because of all the intense workouts that they go through. And it's a fracture caused because of the changed intensity of the workout and how many times a week they go out to go exercise. It can also be caused from prolonged overuse and axial loading or weight bearing, because it causes more irritation to the femur. The muscular tension is also placed in the femoral neck, which can cause two different types of stress fractures. One is a tension side stress fracture, and another one is a compression side stress fracture, and I'll talk about that more later in the presentation. Signs and symptoms of this injury, it can be misleading, because the symptoms that are present are actually similar to other symptoms of other injuries. But the main ones, you have throbbing, burning, or paresthesia, and many patients say that they have pain in the groin or hip, and a lot of the time the pain is caused during the first few steps, like when they get up, or during and after activity. A lot of the time they also complain of night pain, so especially when they turn on their side of the injured side, that causes a lot of pain. And along the femoral triangle, there is also axial loading on the hip joint. If there's any axial loading placed there, it causes pain or shear forces on the femoral neck. There's also you would also be able to note decreased strength in the hip flexors and adductors, and you have to watch the gait of how they walk, because it could be limping. A lot of the time, x-rays are used, but this usually tends to have a negative result, because with a stress fracture, you're not able to see if there's a fracture until the healing process starts. So it's better to use a bone scan or MRI and CT scan, but it's better to use the bone scans or MRI because they're more high sensitive. So the treatment plan, depending on the type of fracture that you have along the neck of the femur, you can either have a tension side femoral neck fracture, which in this case it would require surgery, and weight bearing is not allowed, because this can with tension side, it usually can lead to a non-displaced fracture or a complete fracture, and that could possibly cause avascular necrosis. And with the compression side femoral neck fracture, it's not as bad as the tension side. It doesn't require surgery, but it could lead to complete fracture, so bed rest is required, and it's limited weight bearing for 4 to 6 weeks. Usually patients are placed on crutches, and as soon as they're pain-free, they're able to return to activity, but at a gradual pace, so as not to irritate the injury again. And light running begins within 2 to 3 months. Swimming is allowed, but if the patient prefers to do swimming, it's better not to do the breaststroke. And take-home message: femoral neck stress fracture is an injury it's very hard to diagnose, because it has similar signs and symptoms to other injuries like a groin strain, inguinal hernia, or osteomyelitis. And if a stress fracture is suspected along the femoral neck, then it would be best to get a bone scan or MRI. But also the clinician has to be able to do a very well detailed report on the athlete to find if it is possible for a femoral neck stress fracture.